First question, Dr. Trikha, what I should do to not get infected from COVID-19?
See, as an individual, if you want to protect yourself from getting infected from COVID-19, you should remain inside your house. Don't leave your house unless totally essential. If you have to go out for whatever reason, you should be wearing a mask and you should be maintaining distances. And when you come back, again, you should wash your hands and wash your face before you really eat or drink anything. So you maintain all the sterility possible. In your house itself, wear masks because there could be some asymptomatic carriers in your house, and try to remain in isolation as far as possible. I can very well understand that many people may not have so much of space in their houses, so it is important for even those places, those people to wear masks in the house.
What I should do if I am infected and asymptomatic?
See, if you are infected and you are asymptomatic, that means you have a test which is positive and somebody has told you to do a test for whatever reasons. So if you are infected and you are asymptomatic, so you have to see for yourself that you don't spread it to other people. So you go into isolation, do not sit with your friends or co-workers to eat food or to have tea or anything else, or sit together and watch a TV on the same sofa or something like that. Remain isolated in your room and stop going to your office or your place of work.
What I should do if I'm infected and symptomatic for last 3 to 5 days when I have only fever or when I have fever, cough and cold?
See, if you are infected and you have any kind of symptoms, you have named symptoms like fever and cough, so you should be on regular medications as per the doctor to take care of your fever round the clock, and you could be having some kind of a cough syrup so that your cough is suppressed and that doesn't cause you much of a problem. At the same time, after you have taken care of this fever and cough, you should remain isolated in a room and not interact with other people.
Home isolation or hospitalization? When and how?
See, home isolation, the primary way you can do it if you have a big enough house. If you have 2-bedroom flat and you have 5 people to live in it, I can very well imagine and understand that home isolation is difficult. So then you can go into a COVID care center and not a hospital. There are COVID care centers which have been made by the government all over where people can go and be isolated from their family members. If you have a big house and you are symptomatic and you can stay in a room with a toilet, bathroom and take care of yourself, then you should be isolating in your house. You should only move to a hospital if your oxygen is dipping in your blood, if you are aware of a saturation, a pulse oximeter. If you are not, if you get symptoms, if you feel breathless, then you should consult a doctor and be moved to a hospital.
How to improve my oxygen saturation and what is pronal breathing?
See, it is your oxygen saturation can improve if you can do some respiratory exercises or pulmonary exercises. And it is not pronal respiration. It is lying in the prone position and trying to take deep breaths when you lie flat on your stomach and not on your back. When you lie on your stomach and breathe, there are some people who can even sleep like this or who have a habit of sleeping like this. Then that parts of your lung get ventilated or have when you breathe, air goes to that part of the lungs which are not really full of air when you lie on your back. So when you lie prone, which is on your stomach, and you lie like this for some time, that is known as prone position breathing or prone ventilation or conscious proning.
COVID testing is taking some time nowadays. What should I do about this in case I feel I'm infected?
See, we all know that it may take up to 1 day in a metropolitan city or maybe more or maybe 3 to 4 days in a smaller city to get a report of a RT-PCR. If you think you are positive, you've given your test, the best way is to isolate yourself and consider that you are infective. You can pass on the virus to others and you are positive unless proven otherwise.
Is there any prophylactic medication to avoid contracting the virus?
there were a lot of issues regarding prophylactic medications to avoid getting infected by coronavirus. However, in the last 14 months, the evidence is very bleak or not at all regarding any other medications which you can take and you can avoid contracting or getting COVID-19 virus. Initially, there was a big usage of hydroxychloroquine, but now over the years, over the last 15 months, its use as a prophylactic medication is basically zero.
Is it required for people at home to put on masks?
Yes, this is one of the latest guidelines which have been released by the government and the NITI Aayog yesterday only, because there are a lot of asymptomatic infected carriers in the society. So it is advisable that you remain wearing a mask in the home so that you can avoid getting infected. It is equally important that when you have household helps coming into your houses, they should be wearing a mask and you should be also wearing a mask.
What is double masking? How to do it, and is it mandatory?
Okay, double masking is, as the word tells you, that you wear one mask and you wear the other mask over it so that every part of your nose and the face and the cheek is covered and it prevents any kind of infected air getting into your nose and mouth. It will be difficult to describe the way you do it on the phone, on an audio device, but there are enough of photographs available in the newspaper which tell you how to go about doing it. If you wear double mask, it is known as double masking, the chances of you getting infected from another person or because of airborne aerosols full of virus is decreased tremendously.
Okay, so the next set of questions is about vaccination. I took my first dose of vaccine, had symptoms after some weeks. Can I take my second dose of vaccine at the time prescribed after the first dose?
No, if you have taken a first dose of vaccine and then you have got infected and then you had tested positive and now you have come out of the COVID infection, so you should take the second dose of vaccine at least 4 weeks after you have become asymptomatic. Some people say even 6 weeks, but anything between 4 to 6 weeks after you have come out of the COVID infection.
I am 19 years old. Where can I get the vaccine? Can I get at government hospital or at any private hospital? How much will it cost?
See, you can get it at the government hospital. It will be free for all the citizens of the country. And you can go to the private hospital where the cost would be very minimal. I think it should be about 650 rupees or 700 rupees depending upon which vaccine is available at the private setup. But I suggest you go to the government hospitals where it is not going to cost you anything.
Where and when to get registered for my COVID vaccination, which starts from 1st of May?
To get registered for your COVID vaccination, you can go to the app for the COVID vaccination and you can easily get registered. If you are not computer savvy, you can go to your friend or any other person in your area who's computer savvy and he can get you registered and then you will be given a slot and then you can get it done. If you don't even have that, you can go to any shop which has a computer or who deals in mobile phones or from where you book your tickets, railway tickets. There are so many people like this in the market. They can get you registered on the net and they will not charge you anything.
How will the vaccine be useful for me?
The vaccine will be very useful for you. The first thing is that if you have taken the vaccine, both the shots as per government advisories, and you have developed antibodies, the possibilities that you may not contract the disease, and if at all you get COVID infection, the severity of the disease will be tremendously less. So maybe you would have never to be hospitalized, you will never get that sick, and it's very unlikely that you will ever be needing to go on a ventilator.
Are there any side effects of the vaccine?
Any injections, any vaccines would have side effects which are very rare and government is monitoring them. The most common side effects are some pain and soreness at the point of injection. Then you could have some mild fever or some rash. And it is nothing very serious or significant. If you have anything more than that, the government is keeping a strict watch on these symptoms and these problems. You should go back to the place or there is a phone number available. You could phone them up and they will advise you free of cost and tell you what to do and even tell you where to go to the nearest hospital if you have very serious side effects.
By what time can I expect full protection after taking the vaccine?
100% protection from any vaccine for any disease in the world is not possible. It's only the efficacy or the efficiency of any vaccine which is important. So quite a large number of people would have protection against a disease after they've taken the vaccine as per standard guidelines, and the same thing goes good for COVID-19 vaccination also. So about 2 to 3 weeks after the second dose, ideally 2 weeks, you should have enough of antibodies which are likely to protect you from getting any serious COVID infection.
Can I go out to work after being vaccinated and with the masks on and maintaining social distancing? Am I likely to lose my daily wages for some days?
See, the first thing is you can go to work with mask and social distancing after you've had your vaccinations, provided there are no guidelines or lockdowns or curfews in your area, and you'll have to follow them and follow all those rules by the government. The second thing is, it's also the government has made it very clear that nobody will lose jobs if you are in a government setup, if you are ill or you have been taken down by infection of COVID-19.
Is it mandatory to have COVID-appropriate behavior everywhere?
Yes, it is mandatory, it is essential, and I go a step ahead. It is as essential as you wear your clothes. You wear your clothes when you go out to work, you wear your clothes when you are in your house. So all things which are done in a COVID-appropriate behavior should be as essential as clothes on your body, anywhere and everywhere.
Is there a likelihood of getting some gynecological problems with vaccination?
See, it'd be unlikely that you can get a gynecological problem after it. No, it's not possible. Or if there is a side effect of any which may be very rare, but that is not heard of. We've never seen it so far. There is no government guideline which says that women who are menstruating or having their period should not get their jabs.